lordosis, kyphosis, scoliosis, loss of curvature. In this video, I'll show you how to improve your posture I'll teach you specific exercises to improve the main tensions that misalign our spine and worsen posture. You can choose to do all the exercises and improve every aspect of your spine, or just do the specific exercises for your posture. You have hyperkyphosis, hyperlordosis, scoliosis, straightening uneven shoulders, or a tilted head. And best of all, you'll see that you don't need to be thin, young, or very flexible to have a spine with good movement. And let's start with the tension that hurts our spine the most these days, which is the tension at the front of the spine. When we accumulate this tension at the front of the spine, ficar o sentido spine. Whether it's because we spend too much time sitting, lack physical activity, or have a problem with an organ like the liver or stomach, this front of the spine can cause a straightened lower psoas, like becoming more hunched over, or forward head posture, in which case the cervical spine tends to become straighter. To improve all these problems at once, to address this tension, we're going to combine two exercises. There, start by lying on your stomach, supporting yourself on your elbows, staying in a very relaxed position for you. To increase this stretch even more, I ask that you pay attention to two things. The first one is your breathing. We're going to do a different kind of breathing because the diaphragm is in the middle of this tension. It's the main part. It's a key part, especially because it's connected. It's related to the liver and the stomach and the viscera, the intestines. So it improves both the muscular part and the visceral tension, okay? So in this relaxed position, you're going to do a stretching breath. Exhale for a longer time. Exhale while counting to 3, and inhale on 4. Shall we try it once? So, the second point you need to pay attention to is your neck. Don't keep looking straight ahead. With your chin up, with your chin pointing forward, lower your head until it's aligned with your spine and tuck your chin in. If you can keep your chin tucked in, then that's it. Open your chest. Let your chest face forward. There. And here you can stretch this whole front part of your spine gently and without straining your neck. Doing this along your entire spine. At the same time, here you will stay for 1 to 3 minutes. And here is the secret to this tension, because sometimes it's so hard for us to improve it. Most of the time, this tension in the front of the spine comes from top to bottom. So it starts here at the beginning of the spine, in the joints of the head and the neck. So the second exercise is exactly for that, okay? Lean against the wall, try to touch your entire spine to it, and you're gonna nod yes like this. Tuck your chin in and out, looking down and up without taking your head off the wall. You'll hear your hair brushing and your head rubbing against the wall. Gonna do this slowly, no rush, only as far as is comfortable for you, for 30 seconds to 1 minute. And if it cracks, that's normal. That cracking means we're starting to move those joints, which were sometimes stuck, similar to when you pull on a finger and it sometimes cracks. The next tension we're going to work on is the tension behind the spine, besides that widespread pain in your back. This tension can cause hyperlordosis in the lower back. That person with an arched spine, it can cause straightening of the thoracic spine, and in the cervical area, it causes an increased curve, a hyperlordosis. And that short neck, that person who accumulates a lot of tension and usually has tension headaches. The trick here is for us to understand that this tension usually comes from the legs. This also has to do with those people who are stiff and have trouble reaching the floor with their hand. Are you like that too? You are going to lie down near the wall. It can be on the couch, on the mattress, or even on the floor. Use a high pillow. It can even be 2 pillows.
Pay attention because we're already starting to stretch to lengthen the back part of the spine. You're going to stretch one leg, resting your heel on the wall. I want you, when you pull your foot towards you, pull your toes towards you, to feel the stretch in the back of your leg and not feel pain. Okay? If it hurts, it's because you're forcing it too much. In that case, move farther away. Look, let me show you here. I did the movement there. And then Dr. Alexandra Mota, it hurt. So you move the wall farther away because your leg automatically gets lower. It's like you're stretching less, okay? For me, it's better when it's closer. Great. In this position here, you're going to relax and do this movement with your foot. Look, pull your toes toward you, touch the tip of your foot to the wall. You're going to do this 60 times with each leg. You don't have to do all 60 at once. You can do 3 sets of 20, for example, okay? No rush. Don't force it. Just enjoy this relaxation. Notice that when you pull your foot, sometimes you can feel the stretch deep inside your spine, down in the lumbar region. But as you relax, the relaxation also spreads throughout your entire spine to complete the relaxation of these muscles and even improve the joints a bit, which can be a source of irritation. You're going to do this here. Stand up, place your hands at the level of your lumbar spine around your waist for those who don't know where the lumbar is, and preferably your fingers should touch each other in the back. Now, without bending your knees, you're going to lean back until you get that nice stretching feeling, like when you yawn and stretch out here in the front. See? Go as far as you can while stretching and stay here for 10 seconds, trying to relax your body and breathe very slowly, very calmly. And after 10 seconds, just come back up. Think this exercise is silly? Then do it and try to touch the floor again. Let me know in the comments afterwards. I loved it. Now it's time for us to improve. There's tension that crosses the spine from one side to the other. This is the main tension that makes us keep our head tilted, which we often only notice when taking a picture. You think you're standing straight and everyone else is straight, but you're crooked. It makes one shoulder lower than the other and causes scoliosis in the cervical, thoracic, and lumbar regions. The secret here is to do gentle stretching so you don't force it and let each part relax in its own time. Lie on your side and with your legs together, bend them as much as you can, as if you were bringing your knee toward your chest. Okay? Do this as much as you can too, as long as it doesn't cause pain, obviously. We always need to say that in this position. When you can't bring it any further or before the pain starts, interlace your fingers, rest them on your chest, and let the weight of your arm rotate your body. Your arm's weight will do the stretching, okay? You can already feel it stretching from your hip to your shoulder, going through the middle of your back. Each person here will feel that it's tight, that it's tense in a different spot. Some people will feel that it's tight here in the hip. Others will feel that their spine feels locked up, and others will feel this tension near the shoulder. That's the idea. You do the gentle stretch, focus on your breathing, trying to relax each part of your body, and you'll feel that tension slowly melting away. Just breathe in a relaxed way and try to let the weight of your arm do the stretching. This is very pleasant. You're going to do this for 2 to 3 minutes, 2 to 3 minutes on each side. When you finish the 3 here, or a minute, when you're satisfied, you simply come back, put your feet out, and do the exact same thing. But now, on the other side, it seems like magic, but right away your back feels lighter, and you can stand taller without having to use so much effort. But to make it even better, besides doing these exercises every day, you can prevent this tension from building up again. In this video, I show this 2-minute sequence for you to do before going to bed. Besides relieving the tension from the day, it will give you a better night's sleep and can even make you wake up without pain. If I was able to help you today, remember to share this video with someone who needs it, someone who's in pain and needs to improve their posture. That's all I ask of you. Make sure this video reaches those who need it. I'll wrap up here. Big hug and see you next time.